Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Steve Daly. It's Thursday, October 9th, and today on HITshow, Medicare takes aim at so-called low-value spine surgeries, with a new analysis raising billion-dollar questions for hospitals and surgeons. Then, a major health system merger in New Jersey collapses after 2 years of planning. We'll also look at how one state is reinventing maternal care from the ground up. After the break, Harvard Medical School signs a surprising partnership with Microsoft, and new AI tools for Parkinson's patients are catching attention across the industry. Let's get started. We start with a national story that's rattling the surgical community. New data suggesting hundreds of thousands of spine surgeries may be providing little or no clinical value. Anika Shah has more.
That's right, Steve. Medicare's internal analysis found nearly 200,000 spinal fusion and decompression procedures performed last year that didn't meet evidence-based criteria, costing taxpayers nearly $1.9 billion. The report calls for appropriate use reviews and suggests future prior authorization pilots could extend to hospital outpatient departments. Hospitals argue the data lacks clinical nuance, pointing to complex patient cases not captured in claims.
So what's next? Enforcement or education?
CMS says the goal is quality alignment, not punishment, at least for now. But private payers are watching closely, and experts expect broader commercial adoption of these same review algorithms by mid-2026.
A story every orthopedic and finance team will be watching. Thank you, Anika. Next up, a major hospital merger falls apart in New Jersey. Logan Stokes has the details.
Steve, the Atlantic Health System and St. Peter's Healthcare have called off their planned merger, citing regulatory and operational challenges. The deal would have created one of the largest integrated systems in the state, blending community care with academic ties to Rutgers. Analysts say the collapse signals tighter FTC scrutiny and growing caution among Catholic affiliated systems navigating consolidation rules.
So, what's the ripple effect for regional care?
Expect both systems to double down on partnerships instead of mergers. Shared service lines, IT integration, and specialty co-management without triggering full regulatory review.
Logan, that is an interesting pivot. Thanks for keeping us updated. Now, from mergers to maternity, a case study out of Connecticut showing how localized programs can reshape maternal outcomes. Teresa has that story.
That's right, Steve. Hospitals like Stanford Health are integrating midwifery practices directly into labor and delivery units, while Hartford Healthcare is piloting postpartum rehabilitation programs to prevent readmissions. The state has also launched a wearable safety-bracelet initiative that alerts families and clinicians to early signs of distress after discharge. The result? A 14% reduction in severe maternal complications statewide.
A model that other states might emulate. Great work, Teresa. You're listening to HITshow Daily. Coming up, a Harvard partnership that could redefine medical AI and an innovation boom in Parkinson's monitoring. Stay with us.
HITshow is made possible by EY, a globally connected, multidisciplinary professional services organization driven by innovation and action for the long term. An optimistic future where business, people, society, and the planet thrive. EY can help you shape the future with confidence.
Welcome back. You're listening to HITshow, a headline turning heads across academia and tech. Harvard Medical School has licensed portions of its medical content to Microsoft. Nate Collier explains.
That's right, Steve. The deal allows Microsoft to embed vetted Harvard Health data into consumer-facing tools like Copilot and Bing Health Answers. It's a win for accuracy in an AI world full of questionable medical advice, but it raises new questions about intellectual property and bias. Harvard says it will retain editorial oversight, ensuring that updates and peer review standards are maintained.
And this could set precedent for other universities.
Absolutely. Think of it as the beginning of a content-as-a-service model for medical knowledge, something we may see echoed by Mayo, Johns Hopkins, and others soon.
Appreciate it, Nate. And before we close, neurotech is seeing fresh investor energy. Jade Romero reports.
Steve Rune Labs just closed a new funding round, joining other startups like New Health and New Romedy that are developing continuous Parkinson's monitoring solutions using wearables and smartphone motion data. The platforms connect directly with neurologists, offering real-time medication adherence tracking and symptom scoring. Hospitals like Cedars-Sinai and Mass General Brigham are testing integrations, saying they could finally bridge home monitoring and clinical documentation.
If it scales, it could redefine chronic disease management. Thanks, Jade. Coming tomorrow, more news and a first spotlight on what's shaking in payer tech. That's all the time we have for today. Thank you for joining us on HITshow. If you like these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.